Nasal dorsal aesthetic lines or nose line contouring is a technique in rhinoplasty that has a huge effect on the new shape of the nose. The nasal dorsal lines are two curved lines that start from the top of the eye socket and continue from the radix to the tip of the nose. The importance of the nasal dorsal aesthetic lines is that it maintains the nose's triangular shape, and when watched from the front view, two smooth lines created on the bridge of the nose double its beauty. Performing nasal dorsal aesthetic lines technique during primary rhinoplasty can achieve a better result in comparison with traditional rhinoplasty. While there is not an ideal shape of the aesthetic lines, it is important that they run essentially parallel through the bridge with a gentle flare as they run into the tip. It is important for the rhinoplasty surgeon to create harmony within the nose by designing aesthetic lines specific for each patient. The name Nefertiti means, "the beautiful one has arrived." The favorite wife of the pharaoh Akhenaten, she lived in the 14th century BC. She is considered an icon of feminine beauty and charisma. Anyone who gazes into her eyes will never forget the impression. The shape of the nose is as varied amongst people as the weather is on any one day around the world. While not quite as distinct as a fingerprint, one's nose shape is fairly unique in each individual. Despite this tremendous diversity in appearance, there are certain nasal shapes that many patients strive to achieve regardless of what their natural nose looks like. This creates a real challenge for any rhinoplasty surgeon in trying to achieve patient expectations. Yet, one aspect of nasal shape that is the least controversial and can be argued to be the most straightforward to change is the of the dorsal line. Viewed primarily in the side view, the dorsal line of the nose is the profile shape from the top of the nose down to the tip along the skin. The greatest challenge in primary aesthetic rhinoplasty is the application of advanced anatomical, aesthetic and ethnic principles to an individual case. As aesthetic surgeons, we are often faced with the dilemma of whether to try something new in our practices. For one thing, we face mounting pressure from our patients to adopt new techniques that have been touted as the latest and greatest in the popular media. An attractive nose with compromised respiration is not a success, nor is an unattractive nose with improved respiration acceptable. However, many primary rhinoplasty procedures cause interruption of the infrastructure of the nose without adequate reconstitution of these structures. It has been nearly 130 years since the first publications concerning aesthetic rhinoplasty appeared, and nearly 70 years since Straatsma and Straatsma published their findings on the relationship of the septum to the upper lateral cartilages. However, confusion still exists as to whether the dorsal hump is a fused cartilaginous unit or is composed of separate parts held together with fibrous tissue. Interest in this topic developed because texts by knowledgeable authors, Rees, T. D., Sheen, J. H., Regnault, P., and Daniel, R. K., maintain that the cartilages were separate, yet our own observation during rhinoplasty indicated they were fused. This discrepancy must be clarified because if cartilages are fused, plastic surgeons convert this dorsal cap into three separate parts that are subsequently held by fibrous tissue. This may lead to some of the problems mentioned in the literature, such as an S-shaped dorsum, cold sensitivity, or sharp edges, or it might even contribute to a nasal obstruction by causing a flutter valve effect. Pathophysiology. Both the bony and cartilaginous vaults of the nose contribute to a dorsal nasal hump. The paired nasal bones vary in size, shape, and thickness and generally provide the smaller contribution to the dorsal hump. Most of the nasal hump usually lies in the cartilaginous vault of the nose, consisting of the paired upper lateral cartilages and nasal septum. The depth of the nasofrontal angle and the projection of the nasal tip should also be considered in a prominent nasal hump. Embryologically, growth of the nose occurs from the anterior-posterior expansion of the septum rather than from growth of the nasal bones themselves. An adolescent nasofacial growth spurt begins at approximately 8 to 13 years of age and ends at 13 to 15 years of age. Before and during this growth spurt, gradual ossification of the septal cartilage occurs, with consequent expansion of the perpendicular plate of the ethmoid and vomer. Thus, the nasal hump results from the underlying cartilaginous vault and thin bony cap rather than from an osteocartilaginous structure comprising equal parts of cartilage and bone. What is the meaning of the nasal dorsal aesthetic lines? The dorsal aesthetic line, sometimes referred to as the brow tip aesthetic line. The brow tip aesthetic line curves out from the bottom of the inner eyebrow towards the nose, runs along the nasal bridge, and curves back away from the bridge towards the nasal tip. As emphasized by Kakir, 2016, the dorsal lines begin at the supraorbital ridge, narrow at the radix, flare at the keystone junction, and taper down to the tip defining points. The dorsal aesthetic lines are wider, straighter, and less concave for men. A general rule is that dorsal width should be 6 to 8 mm for females and 8 to 10 mm for males. Ideally, this curvilinear line should not be disrupted by irregularities such as bony abnormalities, contour deformities of the middle vault, and anatomical deviations that cause nasal asymmetries. Conventionally, these lines were thought to be narrowest at the keystone area. However, it has been proposed that these lines are instead fusiform, being narrowest at the radix, wider at the keystone, and again narrow at the supratip. The anatomic contributions to the DALs include the curvature at the junction between the dorsal and lateral aspects of the nasal bones in addition to the architecture of the underlying ULCs. DAL's anatomic contribution includes the ULC, nasal bones, NB, and dorsal and lateral keystone area, DKA/LKA. The four different types of nose widths: dorsal bridge, dorsal base, tip, nostril. Each of the four different nasal widths require a completely different approach. Essentially, the aesthetic dorsal lines are a surface expression of the intrinsic shape of the cartilaginous vault. The dorsal line is affected by the height of the nasal bones and the septum and can appear convex with a hump or concave with a saddle nose. In general, a straight dorsal line is the safest aesthetic shape and would be considered one primary goal in many rhinoplasty surgeries. It is also considered the functionally safest nasal shape as it prevents collapse of the middle vault and potential nasal airway insufficiency. During a nasal analysis, the surgeon should assess the front view of the brow tip aesthetic line and determine the appropriate steps to take during rhinoplasty to ensure that the sides are symmetrical and form the shape of a somewhat elongated hourglass. Notes: the well-shaped nose tip should not be ignored. For the nose contour to be complete and perfect, all its parts must be corrected correctly to get the best result. For example, if beautiful lines are created on both sides of the nose bone, but in the lower area, that is, the tip of the nose does not have the proper shape and angle, obviously the beauty resulting from the nasal contour line attracts less attention. So, if the nose tip has significant defects, the surgeon can angle and correct it based on the principle of polygons in geometry. Nasal surface aesthetics can be analyzed in terms of geometrical polygons, including The glabella polygon, the dorsal bone polygon, the dorsal cartilage triangle, the lateral bone polygons, the upper lateral polygons, the dome triangles, the lateral cruce polygons, the interdomal triangle, the facet polygons, the infralobular polygon, the columellar polygon, and the footplate polygons. However, these traditional dorsal aesthetic lines are slightly different when viewed through the nasal polygon aesthetic unit concept. The dorsal aesthetic lines, as shown in figure, should have a fusiform pattern starting at the brows, with the nasal radix area being narrow, the keystone area wider, and the supertip region narrow again before ultimately diverging at the tip. This fusiform pattern is important in creating a natural-looking aesthetic dorsum. Summary. In addressing the nasal dorsum, the surgeon must have a systemic approach and be familiar with the various techniques to address deformities. As with any aspect of a rhinoplasty, a thorough preoperative assessment and deep understanding of the patient's goals is critical to a successful outcome. The complex anatomy and cosmetic sensitivity of the nasal dorsum makes it susceptible to untoward postoperative imperfections and complications. To evaluate the results, from the anatomical lines of the nasal dorsum, a comparison between the MID and the width of the MNT was used as a reference. A medial intercanthal distance, x. B middle nasal third, MNT, y. Left. A and B, anatomic lines of the nasal dorsum. Right. A and B, normal y between 75% and 80% of x. A and B, MNT measure in preoperative period. C and D, MNT measure in the postoperative period. Telefaxes. Determine before surgery what type of dorsal line profile a patient wants is one of the most straightforward imaging changes to make. In routine undermining of the nasal soft tissues, the dissection plane should be deep to the nasal superficial musculoaponeurotic system, SMAS. Extreme care should be exercised during elevation of the nasal soft tissues, not to disarticulate the ULCs from their attachment to the nasal bones. Many standard rhinoplasty maneuvers, which are intended to improve nasal appearance, actually decrease structural support. An intercartilaginous incision, often used in endonasal rhinoplasty, destabilizes the inferior margin of the ULCs. Removal of a nasal hump often interrupts the medial attachment of the ULCs to the nasal septum. Resection of the cephalic border of the LLCs provides a volume reduction of the nasal tip but can further destabilize the ULC-LLC attachment. This can decrease support to the internal nasal valve. The resultant inverted V deformity is created when the lateral nasal bone is malpositioned and the ULC is too medialized. This creates an overly narrowed or pinched appearance to the middle nasal third. Bottom line. The nasal dorsal aesthetic lines, which are unbroken extensions of the superciliary ridges, connects the radix to the lateral projections of the crura of the lower lateral cartilages by means of two diverging concave lines. In any given patient, the dorsal aesthetic lines may or may not need modification because of asymmetry, excessive width, excessive narrowness, or poor definition. Ideally, the width of the dorsal aesthetic lines should match either the interfiltral distance or the width of the tip defining points.